Good morning, and thank you for joining us for All Things Heart. I'm Alexis Del Cid. We are working hard to bring you some pretty incredible shows this coming fall. Until then, we'll be sharing some encore presentations of our favorite episodes every Thursday morning at 10 a.m. all summer long. So sit back and enjoy this best of All Things Heart.
From the University of Kansas Health System.
I am amazed. The team here is great.
I came on a Tuesday, and then by Saturday I had a heart in me.
I have never seen a group of people work together so good as this team of heart specialists. I mean, it's just unreal.
Stand by to set up show.
And the Dolph C. Simons Jr. Family Broadcast Studio.
Roll it.
Always makes you feel like you're the most important patient on the planet.
I felt heard, and that was really big.
This is All Things Heart.
Good morning. It's Thursday, May 19th. I'm Alexis Del Cid. Welcome to All Things Heart. Here's what we're talking about today. Do you get enough sleep? Many of us, unfortunately, would say no. That can come with serious consequences. We share the heart connection to untreated sleep disorders like sleep apnea. Also, you've seen those beautiful hearts for Parade of Hearts across the metro, and today we have a step-by-step tutorial for you on how you can find every single one of them. Also, behind the mask, we're taking you behind the mask, showing you the incredible things our doctors do inside and outside the hospital. We love showing you the personal sides of our doctors, and we have some good ones today. And as always, if you have a question or a comment, you can share those on Facebook, our YouTube, or you can email us at allthingsheart@kumc.edu. And now to the show. We always hear about the benefits of sleep and the health risks of not getting good sleep. But what if you go to bed at a reasonable time every night and you're still waking up feeling exhausted? It could be a sign of a serious disorder that can lead to devastating heart complications.
Hey, how are you doing?
Good, how are you?
About an hour before he had a team of surgeons huddled over him on the operating table, 32-year-old Aaron Clark talked with us about his biggest hope after all this is over.
I'm looking forward to being able to breathe without using Afrin and just actually feeling rested for once in my life.
He doesn't remember a time ever where he woke up feeling that way.
So I snore really bad, and I always knew that I did. I thought it was just sinus issues.
It turns out Aaron was suffering from something far more serious, sleep apnea, a condition in which your breathing stops periodically throughout the night.
So the tongue collapses into the throat when he sleeps at night and obstructs his breathing.
Plastic surgeon Dr. Ravi Garg explained the special surgery he's now performing.
So we're going to move both jaws forward. The upper jaw is going to come forward, and the lower jaw is going to come forward to meet it to close the bite and open the airway.
They're also cutting Aaron's chin bone and moving it forward. It's a surgery that will last several hours, the recovery far longer. Aaron won't be able to eat solid food for several months, but he knows at the end of this journey, it will be worth it.
That's where the benefits really set in, because with sleep apnea, you run the risk of higher chances of stroke and cardiac-related issues. I'm looking forward to actually having a full night's sleep.
That was a fascinating surgery to watch, and we caught up with Aaron 3 weeks later. He was swollen and still blending up his food to eat it, but he was feeling so hopeful, and he was already noticing a difference. Take a look.
I feel good. I feel more rested. Like Dr. Garg said, I'm sleeping better, dreaming now. I'm able to breathe better throughout the day. Still learning how to talk again, but other than that, I feel great.
Okay, now I want you to stop what you're doing and take a look at your screen. Look at this comparison. These are before and after pictures of Aaron. Look at how different his profile looks because of what Dr. Garg did with his jaw. He looks like a different person. He pulled his jaw forward. Aaron says he's feeling so good today that he's back at work. He works at a nuclear power plant, which is why he can't join us for the program, and he works the overnight shift, so we're certainly not going to wake him up at an off hour for this because he's finally sleeping, but he does say he feels great. Joining us in studio is craniofacial surgeon Dr. Ravi Garg, who performed the surgery. And we also have our cardiologist, Dr. Brian Wyford, who's going to talk about the sleep and heart connection and what happens when you have an untreated sleep disorder. And joining us virtually is another one of Dr. Garg's patients, Kenneth Steely. Dr. Garg performed the same surgery on Kenneth as he did on Aaron, but Kenneth, you had your surgery back in 2021, so you're further along in your health journey. How long were you suffering before you knew that, one, you had sleep apnea, and two, that there was a surgery that could correct it?
So my situation is I've had it since like 2008. I think my first surgery was in 2011. And then I've had a couple other ones. This one right here performed by Dr. Garg was like my last hope. So
your last hope
to kind of get rid of sleep apnea.
Oh my gosh. And Dr. Garg, do you regularly perform these surgeries? I mean, that surgery from a regular person watching it is super graphic. We couldn't show the audience half of what it looked like because it's so extensive. Is that a common surgery?
This is a fairly common surgery. It is indeed quite extensive. We are repositioning the facial bones and correcting the bite, the airway, and the profile in many instances. Often when we do these, it is to correct an underbite, overbite, crossbite, some issue that relates to the occlusion that the orthodontist can't fix by themselves. In many cases, the patient also has sleep apnea, or they're seeing me just for their sleep apnea and they want to have, kind of like Ken did, their jaws brought forward to get that enlargement of the airway to hopefully, successfully treat their sleep apnea.
And Dr. Wyford, we're going to talk with you about the heart connection to untreated sleep disorders. What effect does an untreated sleep disorder have on the heart, like sleep apnea?
You need to think of it as the heart being under strain from that sleep apnea. It's putting pressure in the heart that is creating a buildup of pressure that cycles back into their blood pressure. It can clearly affect the heart rhythm and can ultimately lead to further damage to the heart. As Kenneth mentioned, or as Aaron mentioned, risk for stroke because of abnormal rhythms like atrial fibrillation. So it can affect the body in lots of ways, but especially the heart.
So if you have a sleep disorder and it hasn't been diagnosed, but maybe you're at home watching and you sleep with someone who snores, or you're trying to sleep but you can't because they're snoring, that could be a real sign that something is wrong.
Definitely. One of the problems is that a lot of people who have sleep apnea have no idea they have it.
Right.
And some of the symptoms can be nondescript enough that just waking up feeling tired, many of us can feel that way. So it goes untreated or unrecognized in many people, and that certainly puts them at more risk.
Dr. Garg, how common is obstructive sleep apnea? And is there any other kind of sleep apnea besides obstructive sleep apnea?
Sure. Yeah. So as Dr. Wyford said, obstructive sleep apnea is a significant public health problem. An estimated 15 to 30% of adult men and 10 to 15% of adult women have clinically significant obstructive sleep apnea.
Wow.
There are other types. There are central sleep apneas, which are more central nervous system mediated than upper airway obstruction driven. And that differentiation is made really by the gold standard diagnostic, which is an overnight polysomnogram.
So what are the other options to treat obstructive sleep apnea before or besides that major surgery?
Absolutely. So the gold standard for treatment is continuous positive airway pressure, which involves wearing a mask to deliver positive pressure to the upper airway to stent it open during sleep and prevent it from collapsing.
Is that the CPAP?
That is the CPAP,
okay.
And that is very successful for a lot of patients. And that's what we want patients to use if they can, because it's obviously non-invasive and much lower risk than going through a surgery. However, there are a significant number of patients who can't tolerate the CPAP for a variety of reasons, and that's when they begin to explore surgical options. There are many available. One of the most powerful is max-low mandibular advancement, where we advance the jaw bones forward to expand the airway.
I want to bring Kenneth back in because, Kenneth, you and I have talked about this, and using a CPAP machine was not an option for you. Can you share why?
So I'm a combat veteran, so I have a severe PTSD, and with that is like I have a lot of nightmares, I toss and turn a lot, and there was never a time that I could put on the CPAP and wake up with it on.
Well, first of all, thank you for your service. Thank you from the bottom of our hearts here. I can't imagine what that would be like, and most of us will never have to imagine that, but it must have been a relief to learn there was some sort of surgery that could help you eventually.
Yes, correct.
Dr. Wyford, does the heart repair itself once you fix the sleep disorder?
So the hope is that by getting good treatment of their sleep apnea, patients can have less strain on the heart, and we know that can help the blood pressure get under better control.
Right.
People are less at risk for developing congestive heart failure, less at risk for having a stroke, less risk for having abnormal heart rhythms, even very serious ones. So yes, I think treatment is essential, and ultimately identifying the problem to get treatment is the key.
I want to go back to the before and after pictures that Dr. Garg shared of the patient that we introduced you to in the story at the beginning of this. These before and after pictures are so remarkable. Can you explain again, as we show those pictures, why moving the jaw forward helps?
Absolutely. So the term that I used, maxillomandibular advancement, is a fancy way of saying that we're moving the jaw bones forward to open the airway. The way that works is the upper jaw is attached to the soft palate in the back of the throat, which you see when you open your mouth and look in the mirror. So when the jaw comes forward, the palate comes forward as well, making more space in the back of the throat for airflow to occur. Similarly, when the mandible or the lower jaw comes forward, that brings the tongue forward with it, kind of like a jaw thrust, and permanently expands the airway. At the same time, when the jaw bones are coming forward, the sides of the pharynx, or the lining inside the mouth, back of the throat, is getting tensed. So it's less likely to collapse, while space is also being opened up for breathing at night.
I want to bring Kenneth in again. Kenneth, this surgery is extensive. Did you have to learn how to chew again? And was it like you had a different face when you finally were out of the surgery? I mean, I can't imagine what that would feel like physically, to have your whole jaw and face repositioned.
So the recovery was intense, but I didn't feel like I had to learn to eat again, or you know, it's like I feel like I sounded a little different when I talked, but and my looks, I don't know, you know, it was minor. It was minor. My wife says I look better after it, so.
Oh, she did?
So I'm happy with it.
Was it as profound of a difference as we're seeing when you look at your profile? Did you notice a difference?
Yeah, yes, I could notice a difference, but it wasn't major.
Right.
To me, I still look like myself. So I liked it. You know, it wasn't, I was scared at first, thinking that it was going to make me look like a completely different person.
Right.
But afterwards, I was really happy with the work that he did.
How soon after your surgery did you know, I am sleeping better?
Probably 3 weeks, 2 to 3 weeks. Once the swelling started going down, 2 to 3 weeks.
And did your wife, was she sleeping better because you're not snoring anymore?
Yes, I stopped getting hit and kicked and pushed to roll over.
What does it feel like when you wake up in the morning now, compared to what it felt like after a night of, you know, sleep, I'll put that in quotes, before your surgery?
I definitely have more energy. I feel more alert. I've noticed like the black bags underneath my eyes are starting to go away, and I've had those for, you know, 15 years. So I'm starting to see some real health benefits of the surgery.
Do you know if you were snoring your whole life?
No, I wasn't my whole life. But as I got older and I started to gain more weight, and then, you know, I really started noticing it about 2006 to 2008 is when I started snoring.
I want to ask Dr. Wyford, does every sleep disorder affect your heart, or is this sleep apnea like the Mac Daddy of sleep disorders that does the most damage?
Well, as Dr. Garg mentioned, there's different variations of sleep apnea, and I would also add that there's different levels of severity. Some people have milder cases and some have more severe cases, but I think the real key is that this is affecting a tremendous number of people. So on a global scale, this is a very significant problem. So from that standpoint, I think sleep apnea is the worst. And because so many people don't know they have it and can go a long time before they get appropriately treated for it, it makes it all the more serious.
How do you know you have it if you don't have someone pointing it out to you that you're snoring? I mean, like you said, Dr. Wyford, most of us wake up feeling tired, even when you go to bed at a normal hour.
So sometimes we identify it when people come in the hospital with abnormal heart rhythms like atrial fibrillation, for example. Or we identify it when some people are referred to our clinics for assistance with their high blood pressure when they've tried 3, 4, 5 different medications and haven't been able to get their blood pressure under control. But I think when we carry extra body weight, that's probably the biggest risk factor for it. So being more tuned in to attention to trying to lose weight and keep a healthy body weight is one of the keys to identification.
So how common would it be to have a cardiologist refer a patient to you? Who's referring those patients to you for that surgery that you've performed on Aaron and on Kenneth?
It's actually a variety of means by which patients get to me, because first they really do want to try CPAP and more conservative treatment options. So patients are seeing me by self-referral sometimes when they have run out of options and they're looking for something that's going to be hopefully dramatic for them and solve the problem. Orthodontists send me patients when they know that a patient has a problem with their bite and their airway and that needs to be corrected. Primary care providers, sleep specialists, some of my ear, nose, and throat otolaryngology colleagues will send me patients as well. So it really just is the full gamut.
And Kenneth, how did you discover Dr. Garg?
I discovered him through the VA. I've had my tonsils removed. They shaved my palates. I've done a high weight bone suspension surgery, and then it was going to go to, I forget the name of the device. They were going to install a device, that I had to turn on and off every morning and night, and I kind of didn't want to do that. And so they referred me to Dr. Garg, and we decided to go with the surgery.
So Dr. Garg's the miracle worker, that when all else failed, you were able to go to him. We're getting a lot of viewer questions and community questions, so I want to get to those. The first one is coming to us from our viewer, Julie High. She would like to know how many of these procedures has the health system performed? Do you have that number off the top of your head?
I don't have that number, but I'll say that I see several patients every week in consultation for orthognathic jaw surgery, and we perform a handful of these procedures every month.
And can you say the name of the procedure that you performed on Kenneth and on Aaron?
Yes, I think the easiest way to understand is it's corrective jaw surgery or jaw advancement surgery. The fancy medical term is maxillomandibular advancement surgery, plus genioglossus advancement for the chin and the genioglossus muscle.
And we're showing some more video of you and the surgery that you performed on Aaron, and you also performed it on Kenneth, as we answer some of these questions. Sarah Heinen has a question. She wants to know, doctors, at what point in the symptoms does snoring turn into something that needs further investigation? Do you want to go first, Dr. Wyford?
Sure. So I think many people can snore who don't have sleep apnea.
Right.
But snoring is one of the most common symptoms that help identify people with sleep apnea. So I would say if there are other symptoms of concern, like difficult to control high blood pressure, shortness of breath with activity, other conditions like diabetes that are also something a patient is struggling with, then to me getting an evaluation for it, especially if they're waking up feeling tired and unrefreshed in the mornings. Headaches in the morning can be another symptom that can point to sleep apnea, to add another clue.
Jenna would like to know, if you have sleep apnea, should you also be seeing a cardiologist in tandem with your other doctors?
I think it's reasonable, but may not necessarily be something to jump right into. This is many times dealt with in a primary care type of setting, and sometimes then with a referral to a sleep medicine clinic. But we're always happy to see patients with sleep disorders like sleep apnea, especially if there's any concern that it's affecting their heart negatively.
Question for Dr. Garg from Julie. Is it possible the length of time for the surgery will be reduced in the future? It's a 3-hour surgery? How long is a surgery?
Actually, it takes anywhere from 5 to 7 hours to do this surgery because it's quite technical. We're making a lot of movements and we want to be very precise. I don't anticipate that we're going to be reducing the time that it takes to do the surgery, but we definitely have newer technology to make the results of the surgery more precise. In fact, we plan the surgery on the computer before we even do it on the patient, and so we have really nice tools to help us deliver a very good result to the patient.
Gretchen has a comment, and the comment is for Kenneth. She wants to thank you for your service, Kenneth. And she also says, thank you for talking about PTSD. I was wondering, is that common among other combat veterans that they can't use a CPAP because they have that anxiety? Do you know of any other people who've gone through the same journey?
Yes, it's extremely common among some of my friends that been diagnosed with PTSD and sleep apnea, and so there's other surgeries out there that I've tried and they were just unsuccessful, and so with this one it's been successful. I think I was over a 40 something on the I think anything over a 5 is major sleep apnea, and I was over a 40 something, and after the surgery while I was still recovering, I was definitely under a 5. So it was a big decrease in my sleep apnea.
That's huge. Amy January has a question. She would like to know, is treating sleep apnea good for blood pressure management? I think
Absolutely.
I know what your answer is going to be. Yeah.
Absolutely. We know that people who have sleep apnea that's unrecognized and untreated have a greater tendency for high blood pressure or a requirement for more medication. So I generally tell people that with treating their sleep apnea, we could hope to see a reduction in their need for blood pressure medicines and hopefully better blood pressure control.
Susan has a question. Susan would like to know, how accurate are sleep studies? Is it subjective to who performs and reads the study? That's a good question. Are you comfortable answering that, Dr. Garg?
Yeah, that question is best answered by a sleep medicine specialist, but I can say that the gold standard is the overnight in-house polysomnogram. There are portable home sleep studies, and I believe they have variable efficacy.
Okay, that would make sense. Susan, I'm going to try to get with a sleep specialist and get your question answered and hopefully get back to you online. Gretchen has a question about dental implants. Are people with dental implants more susceptible to heart attacks? Dr. Wyford, have you heard anything about that?
I don't know that I can speak to specific studies about that, but it would make sense to me that if your dental implant is controlling sleep apnea, that should be reducing your risk. But I think, you know, as Kenneth mentioned, the difference in the number of apneas that he was having before his surgery versus after his surgery, I think maybe getting a test to ensure that there's been improvement in the sleep apnea before and after the dental implant could be helpful.
So Kenneth, when Kenneth was talking about how he was at a 40, that means he was having 40 apneas every night? And an apnea is when your heart stops. Am I understanding that correctly?
Yeah, if I may. So yeah, Ken had a sleep study before we did surgery, and that showed severe obstructive sleep apnea. So the categorization is an apnea-hypopnea index, which is the fancy way of saying the sleep score. Over 30 is considered severe. 5 to 10 is mild, 10 to 15 is moderate. So he was well over 30. And I'm sorry, what was the rest of that question?
I was just asking, does that mean his heart was stopping that many times during the night?
What that means
or his breathing
is
was
that
stopping, I mean, not
his
heart.
airflow was decreasing. Yeah. So an apnea is when there's a reduction in airflow by, I believe, about 90% for a period of at least 10 seconds. And so there's basically a stop in airflow. And hypopnea, which is the other term used to measure severity of sleep apnea, is a smaller reduction in airflow. So he was having problems getting air to his lungs and to his body.
And that's why he would have dark circles under his eyes too, not just because he was tired, but because he's not getting enough oxygen and airflow and everything. Wild. Brett has a question about snoring. This is kind of funny. Why does my wife say I make snoring sounds when I sleep on my back, but not on my side? Are you qualified to answer this question, Dr. Wyford or Dr. Garg?
I think Dr. Garg should tackle this one.
Is there something?
There is, yeah. So, you know, when you sleep on your back, there's just more collapsibility of the tongue and the palate into the back of the throat. If you just think about gravity is going to bring your tongue back towards the back wall of your throat. If you're on your side, it may fall more to the side. And so it's really very much mechanical. And oftentimes, just by changing your sleep position, that can make a difference.
Is there anything that, Kenneth, that you do now differently that you couldn't do before? Like, do you enjoy sleeping on your back now when you couldn't before, or do you even think about that anymore?
Yeah, no, it's definitely, the surgery saved my shoulders, my hips. I was having a lot of hip pain and shoulder pain from having having to have to sleep on my side. And now I can sleep on my back with no issues. And mine was so severe at times. Is like I would wake up and I felt like I was having a panic attack. Like I would just couldn't breathe, and I would just jump up out of bed, kind of like just gasping for air. And since the surgery, I haven't had one episode of that.
JJ has a question. JJ wants to know, why do more people or most people have heart attacks when they wake up? Is that a thing?
Well, I think people can have heart attacks at any time of the day.
Right.
But there's different times throughout a day where our body produces different stress hormones or higher levels of stress hormones. But I think in the context of sleep apnea, when people are sleeping at night and having drops in their oxygen frequently, it's almost like the heart is getting a workout when it should be resting. So if you had very bad sleep apnea and you're having severe disruptions in your oxygen levels, then the heart is clearly under greater strain. So it could be at risk for a heart attack.
And I have one more question from Frank. And I'm not sure, Frank, if this should be referred to our sleep specialist, but I'll give it a go out here. We'll see what we can get you. Frank would like to know, I've heard that based on sleep cycles, you feel just as rested if you sleep 4 hours as when you sleep 8. Because anything between 4 and 7, you're waking up in the middle of a cycle. Is that true? Is that a sleep study question, a sleep expert question?
I think so.
I think I feel rotten with anything under 7. I don't know if it matters about what cycle I'm waking up
throwing
in.
that to the sleep experts.
We're going to throw that to the sleep experts. But keep your questions coming, because the beauty of this is they live forever on Facebook, and we can try to get to our experts and get back to you. Looks like we might have lost Kenneth. We're going to try to reconnect with him. I want to ask our guests for some final thoughts, though. Let's start with Dr. Garg. Dr. Garg, as you, oh good, we have Kenneth back. As you sit here today and you see the success of Kenneth and Aaron, and you talk to a cardiologist, what do you want our viewers to know?
Sleep apnea is a really important problem to take seriously, and treating it can make a profound impact on your life. I think exploring options with your primary provider is a good way to start. What I do is very specialized. It's available for patients who are seeking a surgical treatment, but I think the message to viewers is just to talk to their primary provider if they're concerned about their sleep apnea.
And Kenneth, do you have any final thoughts for our viewers who are watching? Any message you'd like to get across to people who might be suffering that haven't gotten help for their sleep disorder yet? Oh, you're on mute. There we go.
They talked about a lot of the symptoms of sleep apnea, and if you have one sign or you're concerned at all, go get seen, because there's a lot of different treatment options out there, and once you find the right one, it's life-changing.
And Dr. Wyford, what about you?
Heart disease is the leading killer of people all around the world, and part of how that happens is it's flying under the radar screen for a lot of people, and sleep apnea can contribute to that too. So as Dr. Garg mentions, and as Kenneth mentions, getting evaluated, talking to your primary care provider, getting evaluated, and hopefully getting treated if it's found.
And again, Kenneth, thank you for sharing your story, and thank you for sharing about PTSD and talking about that. It's going to help a lot of people, anyone who's watching this. I also want to switch gears to a neat part of our show called Behind the Mask, where we share what gives our healthcare workers joy outside the hospital walls. We know they love helping patients. Speaking of sleep disruption, though, Dr. Garg, rumor has it you're not quite getting a full night's sleep because you're a new daddy.
This is true.
Okay, I want you to tell us about that little bundle of joy that's laying on your chest in this picture.
Yes, he is a bundle of joy. He is a true blessing. My wife and I are just delighted. And yes, he does keep us up at night.
When was he born? What's his birthday?
March 30th.
Okay,
he was born in the middle of that evening thunderstorm and the thunder and lightning, and he came out with a roar.
Oh my gosh. And are you comfortable sharing the name?
Yeah, his name is Ryan. It's spelled R-I-A-N. Makes it a little different, but yeah, he's our first, and definitely just words can't express how happy we are.
Oh, that's awesome. How many hours are you getting of sleep?
Well, my wife is amazing, and she's really helping out a lot at night, especially when I have surgery the next day.
Yeah.
But it's, 5-ish hours.
5-ish?
Yeah.
You feel like a zombie some days. That's right.
Some days, but it's enough. I've been through residency and fellowship, so I think we've been hardwired for this.
Well, he's adorable.
Thank you.
Dr. Wyford, you say what gives you joy is if you could pick anywhere, it would be to be outside in the mountains somewhere, either snowshoeing or hiking. Where are these pictures taken?
This is Colorado. And yeah,
it's your happy place?
It's my happy place for sure.
How often do you get there?
As often as we can, but usually about every 3 or 4 months.
I haven't met many people who say snowshoeing when I ask them what one of their favorite winter sports is. They'll say skiing or, you know, mountain hiking stuff. How'd you get into snowshoeing?
Well, I love to ski, and what we found is that we have a couple dogs, including one who was made to be in the snow. And so talk about joy when you have a dog that's just in heaven in the snow. So we love taking the dogs out on the trails.
Well, we want to wrap up this episode with a little show and tell for you as well. It involves 154 giant hearts. We're talking about the Parade of Hearts that are decorating the whole metro area, and so many of you have been reaching out to us asking how you can see them all. There is an app for that, so we put our reporter Anthony Nickens on the Heartbeat to show us how the app works.
That's right, Alexis. We are standing next to one of those incredible hearts right now outside of the hospital. And we have a fantastic tool to show you how to navigate all of those hearts. And it's right here on your phone. Let's get into it. Simply start by downloading the free Parade of Hearts app on your Apple or Android device. Once you've downloaded the app, you'll have access to all of its great features. You can learn about each heart's artist and inspiration. You'll have access to an interactive map that allows you to navigate neighborhoods with hearts and track hearts that you've already seen. You can even create your own heart. Check out the one I made. What do you think? I know. I'll stick to my day job. But in the meantime, this is a great activity to do alone, or you can invite some friends and family out and have a scavenger hunt. Whatever floats your boat. Back to you in the studio, Alexis.
I want to bring Anthony with me if I do a scavenger hunt. He's fun. Thank you, Anthony. The Health Systems Cardiology Department is also getting a boost from the Parade of Hearts. Dr. Mark Wiley, the chair of cardiology, says some of the money raised is going to be used to expand some major programs here. And these programs help patients with all sorts of heart issues.
Cardio-oncology is one of the big programs that has been growing with our cancer program just exponentially. The advanced heart failure program, the structural cardiology program, all of these are very imaging intensive programs. And we're working on expanding our adult congenital heart disease program as well.
And you could own one of these hearts because next month each giant heart will be auctioned off to the highest bidder. Thank you so much for being with us today. Next week on All Things Heart. It was a typical high school baseball game until this. A local teen collapses on the mound. His life nearly ends until you see what happened after this moment. We hear from him, his parents, about the life-saving equipment you need to ask about as your kids start their summer activities. That's next Thursday morning at 10. We'll see you then. Thank you so much for joining us this morning for this Best of All Things Heart. We love sharing these important stories with all of you. So remember, you can always email us at allthingsheart@kumc.edu, or you can reach out to us on Facebook, Twitter, and on YouTube. We will be back with live shows focused on all things heart every Thursday morning starting September 8th. Go out and make it a great day.